Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are talking about fluoxetine, also known by the brand name Prozac. Before we get started, remember that this video is for educational purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Please do not start, stop, or change any medication without speaking with your prescriber. Alright, let's talk about fluoxetine. And don't worry, we are going to keep this simple. We are not here to wrestle with a pharmacology textbook today. We are here to understand the medication in a way that patients, families, and providers can actually use. What is fluoxetine? Fluoxetine is a medication in a class called SSRIs. As SRI stands for selective serotonin reuptake inhibitor. That means fluoxetine helps increase the availability of serotonin, a brain chemical involved in mood, anxiety, sleep, appetite, emotions, and emotional flexibility. In simple terms, fluoxetine helps serotonin stay available longer between brain cells so the brain can communicate more steadily over time. Think of serotonin like a message that says, pause, breathe, we are not falling apart. Fluoxetine helps that message stay on the screen long enough for the brain to read it. It is not a personality transplant. It is not a magic happiness button. It is more like helping the brain turn down the emotional smoke alarm that keeps going off because someone made eye contact with you at the grocery store. What is fluoxetine used for? Fluoxetine is commonly used for major depressive disorder, obsessive compulsive disorder or OCD, panic disorder, bulimia nervosa, and premenstrual dysphoric disorder or PMDD. It may also be used off-label for anxiety-related symptoms, depending on the provider's judgment. Fluoxetine is one of the more activating SSRIs, which means some patients may feel more energy. That can be helpful for depression with low motivation and fatigue, but it can also be uncomfortable for patients who are very anxious or sensitive to medication. So when we teach patients, we can say when fluoxetine can help with mood, anxiety, obsessive thoughts, panic symptoms, and certain eating disorder symptoms, but it takes time and consistency. How fluoxetine works in the brain. Brain cells communicate using chemical messengers called neurotransmitters. Serotonin is one of those messengers. Normally, serotonin is released, sends its message, and then gets taken back up into the sending nerve cell. That taking back up process is called reuptake. Fluoxetine slows that process down, so more serotonin remains available in the space between brain cells. But here is the important part. Fluoxetine does not usually work overnight. This is not like taking pain medicine and expecting relief before the commercial break is over. A common timeline is week 1 to 2. The body is adjusting and side effects may show up. Week 2 to 4, some early improvement may begin. Week 4 to 8, mood, anxiety, panic, or obsessive symptoms may improve more clearly. Beyond 8 weeks, dose adjustments may still be needed. Fluoxetine also has a long half-life, which means it stays in the body longer than many other SSRIs. That can make discontinuation symptoms less intense for some patients compared with shorter-acting medications. But it also means medication changes, and interactions may take longer to fully clear. In plain language, fluoxetine does not leave the party quickly. It is the guest still helping clean up after everyone else has gone home. Starting dose, titration, and maximum daily dose. For adults with depression, a common starting dose is 20 milligrams by mouth once daily, usually in the morning. For patients who are sensitive to medication, anxious, older, or prone to side effects, some prescribers may start at 10 milligrams once daily and increase as tolerated. For OCD, panic disorder, or PMDD, dosing may vary by diagnosis and patient response. A common titration approach is to increase gradually by 10 milligrams to 20 milligrams at a time, usually after several weeks, depending on tolerability and symptoms. The usual maximum daily dose is often 80 milligrams per day, depending on diagnosis. Simple dosing summary. Starting dose. Commonly 10 milligrams to 20 milligrams once daily. Titration. Increase by 10 milligrams to 20 milligrams. Maximum daily dose. Commonly 80 milligrams per day. Remember, the goal is not to run to the maximum dose like we are trying to win a medication marathon. The goal is symptom improvement with the fewest side effects. How patients usually take fluoxetine. Fluoxetine is usually taken once daily, often in the morning. Why morning? Because for some people, fluoxetine can be activating. If a patient takes it at night and then says, "I stared at the ceiling until 3 a.m. thinking about every mistake I made since 2009, then morning dosing may be better. Patients should take it consistently every day. A simple way to explain it is, take this medication daily, not just on hard days. It works by building steady changes over time. Fluoxetine is not a rescue medication. It is not emotional caffeine, and it is not a panic button. Common side effects. Common side effects may include nausea, headache, diarrhea or stomach upset, sleep changes, and feeling jittery or activated early on. Sweating, reduced appetite, sexual side effects, dry mouth, and fatigue or restlessness. Some side effects improve as the body adjusts. If nausea happens, taking it with food may help. If sleep becomes worse, morning dosing may help. If sexual side effects occur, patients should be encouraged to tell the provider. This is not something to be embarrassed about. You can say, "Some people notice changes in desire, arousal, or orgasm. If this happens, let me know. We have options." Because if we do not ask, patients may just stop the medication and disappear like a Netflix password after a breakup. Now let's go over some very important safety warnings you should be aware of. First, suicidal thoughts and behavior. Antidepressants may increase suicidal thoughts and behaviors in children, adolescents, and young adults, especially early in treatment or after dose changes. Families should monitor for worsening mood, agitation, impulsivity, restlessness, unusual behavior, or new suicidal thoughts. If someone is in immediate danger, call emergency services or go to the nearest emergency room. In the United States, call or text 988 for the Suicide and Crisis Lifeline. Second, screen for bipolar disorder. Before starting fluoxetine, screen for mania or hypomania. Ask about decreased need for sleep, racing thoughts, impulsive behavior, grandiosity, risky activity, and periods of unusually elevated or irritable mood. If someone says, "I slept 2 hours a night, started a company, bought a drum set, and decided I should become mayor," we are not just clapping for ambition, we are screening for mania. Third, serotonin syndrome. This can happen when serotonin activity becomes too high. Watch for agitation, confusion, fever, sweating, diarrhea, tremor, muscle stiffness, fast heart rate, and overactive reflexes. Fourth, drug interactions. Because fluoxetine stays in the body longer and affects certain liver enzymes, it can interact with other medications. Always review the full medication list. Next, let's discuss what families should understand about this medication. Fluoxetine is not meant to make someone fake happy or emotionally numb. The goal is to reduce symptoms so the person can function better. That may mean fewer crying spells, fewer panic symptoms, less obsessive thinking, better motivation, and more emotional breathing room. Medication does not do the life work for you. It lowers the volume on the symptoms so the person can practice therapy skills, coping tools, healthy routines, and support. Medication and therapy are teammates. One is not the superhero while the other holds the cape. Teaching points. Number 1, teach patients that fluoxetine takes time. Number 2, explain that it may be more activating than some other SSR is. Number 3, include dosing education. Starting 10 to 20 milligrams, titration, max 80 milligrams. Number 4, screen for bipolar disorder. Number 5, review interactions. Number 6, ask about sexual side effects. Number 7, monitor sleep, energy, agitation, and activation. Number 8, encourage consistency. Number 9, involve family when appropriate. Number 10, keep education simple. Patients need to know what it is for, how to take it, when it may work, what side effects to expect, when to call, and how follow-up will happen. Let's bring it all together. Fluoxetine, also known as Prozac, is an SSRI that helps increase serotonin availability. It is used for depression, OCD, panic disorder, bulimia nervosa, and PMDD. It is usually taken once daily, often in the morning. It may be more activating, so monitor sleep and anxiety early on. Dosing starts at 10 to 20 milligrams, with a max of 80 milligrams. Fluoxetine is not magic. It is not a personality transplant. It is a tool. And when used carefully, it can be very helpful. Thank you for watching. Again, my name is Dr. Ben Osevwe, DNP-PMHNP. For support, you can text 8329916516. Please subscribe to our YouTube channel for more educational videos and join our mentorship family today at rotationmatchnetwork.com. And remember, anxiety may be loud, but with treatment, skills, support, and practice, it does not have to be in charge. I'll see you in the next video.